The following experiment was conducted by Paige Anderson of Georgia State University in order to observe the effects of virtual reality exposure therapy has on an individual with social phobia. Social phobia is the fear of being negatively evaluated or judged. It is not known whether or not virtual reality can elicit a fear response in order to conduct exposure therapy. This is where the study comes in. Two women were selected for this experiment. Sonia is a middle-aged Caucasian woman who was diagnosed with social phobia non-generalized subtype. Tricia is a middle-aged Caucasian woman who was diagnosed with social phobia non-general subtype along with general anxiety disorder. Both women had very negative thoughts towards their capabilities of speaking in front of crowds and believed their capabilities of public speaking were very poor. Each woman had a slightly different course of treatment. Tricia had received 10 psychotherapy sessions. The first 5 focused on skill training in order to manage anxiety, while the next 5 sessions were focused on exposure therapy. These exposure sessions included small group exercises. Sonia decided to focus on exposure for her treatment. Sessions 1 and 2 focused on talking into a camera and watching the film. Sessions 3 through 7 consisted of virtual small groups, and session 8 was spent reviewing tips and advice. Both women spent one session performing a speech in front of a camera. After giving the speech, each woman watched themselves and reviewed how they did. After this exposure session, there were several other small group exercises. This exposure consisted of a virtual audience. The therapist was able to change the audience's expression, which included friendly and bored. Each one was given a podium which displayed their speech and a small joystick in order to switch between PowerPoint slides. Additionally, there was a virtual curtain which could be opened and closed in order to display the audience. Sonia took advantage of this feature by giving 3 speeches behind the curtain. When she was comfortable with giving a speech behind the curtain, she then performed 4 speeches with an audience, 1 friendly audience and 3 bored audiences. Tricia did not use the curtain and only presented 4 speeches in front of 1 friendly audience and 3 bored audiences. Both women did not proceed from the friendly audience until they were comfortable giving a speech. Anxiety levels were tracked using the Subjective Units of Distress Scale, or SUDS. Through VR, the therapist was able to monitor the patient and speak to her via a microphone in order to give encouragement and help the patient to remain calm during a stressful time. Additionally, the therapist can encourage the patient to stay in the environment until her anxiety lowers, ultimately reducing the fear response towards the crowd. After VRET, both women improved from their baseline ratings for social phobia. When looking at the data, it can be seen that there is a difference in anxiety levels based on their pre- and post-treatment SUD scores. The greatest difference in scores for Tricia was 50 points, while for Sonia it was 80 points. Statistical analysis were not performed due to the low sample size of 2 individuals. However, the results were compared to a similarly performed study based on behavioral treatment of social phobia. This comparison had a very similar data approach for treating the patients with anxiety. Based on this, it was concluded that the VRET had some validity to the results even without statistical analysis. Even though there was no true statistical significance, this experiment gave some evidence towards the effectiveness of VRET. Sonia took 2 questionnaires that indicated that the VR experience was very immersive and effective. Additionally, both women showed large improvements. Before exposure, the patients were handicapped by their social phobia. After exposure, they reported anxiety levels similar to the levels that the general public experiences when public speaking. Both women believed that their speeches were adequate at the end of the therapy and found improvements in their quality of life after treatment.